Welcome to Consulting Chaik, and this is a departmental video. And today we are going to talk about internal marketing. So this is specific to the marketing efforts that you need to do and certain other things that will actually help improve the image of the hospital that you do inside the hospital. Okay, so let's begin. Okay, so this is what we will be talking about. Number one is the patient feedback, the whole system about the feedback. Then we have PREM, that is patient related experience measures. Then PROM, that is patient related outcome measures. So these two and the first three, it's and even the next part of training, this is all related to NAVH. Okay, and the other ones are related to operations, the regular operations of the marketing efforts. So, and then we have the social media, and then certain achievements that we do, we need to display that. And then fourth is the most important, to have a periodic check of everything that we are doing. Here we have the patient feedback. So the patient feedback, I would generally suggest to do it department wise, so that the patients can tell about each department, how did the patient feel about each department. And to capture the data, you can use through the HMIS that you have. And you can, if you don't have that, then you can or if it is not fully functional, you don't have those modules, then you can simply use a free tool of Google form. You can make a QR code and put it there, change it every month, so that every month you can have those datas coming in. Okay, then you should do the monthly analysis and understand in which departments the improvement is required and which department are performing very good. Then of course, to take actions. So whatever the analysis you are doing, if you're not taking actions upon that, then the analysis has no reason. The whole exercise will have no meaning to that. And then you should also do some Google reviews. Google review is an important thing. Whether it is Google review or patient feedback, there are generally three kind of feedbacks given in the Google review. One is the patient had a very bad experience. So the bad experience will be you'll be able to see it in Google review. Second is the patient who are really happy about the experience. So they write about the whole experience. They even mention about certain stuff. They mention about the doctor. They mention about the whole service, how experience, what kind of experience they got. So you'll get those kind of reviews in Google reviews. And then the third type is we have seen that in many places the staff themselves, they write in the Google reviews. Okay. We have PREM, that is patient related experience measures. So you can capture it through a questionnaire or through Google Forms. I always recommend Google Forms because it is easier for you to put the data and to analyze it. It automatically comes in a Excel form. Okay. So PREM is basically the experience of the patient, which is sometimes not captured by the feedback form. So the experience of the patients, that the point of view of the patient needs to be captured in the PREM tool. Okay. So registration. So the PREM tool can have particulars about how the experience of the patient was regarding the registration, regarding the OPD or the emergency, and the IP, radiology, how the patient was transferred and all, about dietitian, about the housekeeping, about the lab and sample collection, about the OT, how whether the surgeons they took the consent and explained everything. The anesthetist did a PAC and explained everything to the patient. Did they do the particular diagnostics tests before they came to a conclusion, and about the billing they can have those questions asked to them. The hospital can ask these questions to them so that they identify the patient experience. Okay, yeah. And then we have the PROM tool. In PROM, again, you can use a questionnaire or a Google form for the obvious reasons I just covered in PREM slide. And you need to have certain tools to capture the data first, to capture the outcome, so before and after. Okay, so you can use the same kind of questionnaires that are available. So there are certain examples like EQ5D. So it's a 5-dimensional questionnaire that measures overall health related quality of life. And then you have SF36, which is a 36 item survey that assesses physical and mental health across 8 domains of quality of life. And then you have PHQ9. This is something to do with the psychiatry. And then you have EQVAS. It's a 0 to 100 visual scale where patient rates how good or bad their overall health is at that point of time. And the key part about PROM is the PROM outcome questionnaire. So you need to ask about the history of the patient, ask about the patient, what was the what disease, what condition the patient had. Okay, what disease we are talking about, what case we are talking about, and then the history of that particular disease, and then physical examination, what was found out in the physical examination, and then investigation, what investigations were done, what diagnosis was given, and what treatment plan was done. And then the most important part of the PROM thing, what was the before scenario and the after scenario. So the outcome is basically seen here. Okay, so through the outcome measures, when we ask these patients, so they start having trust in the system that the hospital is following, hence contributing in the internal marketing. Okay, so you have about the patient and history, physical examination, investigation, diagnosis, treatment plan, and before and after scenario. So in order to contribute to the internal marketing, it is important that the patients, they have good experience inside the hospital. They have a positive experience with the staff. Okay, so the staff, they need to undergo certain training. So one training can be regarding the effective patient communication, which will be focusing on listening and using simple language and respectfully answering the questions to reduce anxiety. Okay, so you need to have empathy while talking to the patients. And then you have regarding safety, quality, and clinical etiquette. You need to the staff needs to follow the infection control processes, how they are taking consents, whether they are explaining the risk, doing their SNDT, and making the patient understand, patient or the attendant understand about the various risk of the procedures the hospital is about to do with the patient. And then the patient right practices. Okay, so respecting the patient rights. So again, the staff needs to know about the whole patient rights. Okay, and to make them understand, while talking to the patient, they can also tell the patient that, see, you have these rights, so I'm respecting those rights. So when they talk like that, it builds trust in the system. Okay, then we have regarding the service excellence training, which teaches front office and support staff to manage queues, calls, and complaints politely and efficiently. Okay, so many a times it happens that the patient feels like their voice is not heard by the hospital, and that should not be the case. If a patient goes out of the hospital, um, seeing that their query is not closed, then this same unsatisfied patient will go out and say bad things about the hospital, and hence compromising the um, image of the hospital. Then you need to uh, have the cultural teamwork training, which helps staff respect diverse patient needs and coordinate smoothly across departments for seamless experience. And most importantly, you need to actually target the problem and act as you see it. Okay. Next, it is about social media. So in social media, you need to put out a lot of contents. So for social media, you can use YouTube, Instagram, Facebook, all three. It is recommended to use all three, and accordingly, what is as per the relevant contents, you can put those things. So any long video, you can put it in YouTube, and all kind of post, you can put it in Insta and Facebook. First thing, you should take certain testimonials, certain very landmark important big cases, and from those patients you should take very short testimonials. Okay, and basically those are success stories. Then you should promote about the CSR activities that you do, certain camps that you do, certain donations that you do, or certain activities that you do internally inside the hospital for the benefit of patients. And then you should show your strengths. Show strengths as in certain USPs that you have, certain kind of processes or certain um, achievements that you have. You should try to show that in the social media. Okay, and then it's not like that you have one thing and you are making one video or one content about it, but every content that you put should have some kind of link with the USPs that you have, certain strengths that you have. So those things should be highlighted in each post. You should try to do that in each post. And then you should also highlight about your employee performance. So any employee of the month that you give, or any employee of the year that you recognize certain employees. So, and why you are recognizing that, because of certain things that they have done for the patients. So all those things should be highlighted in the social media. Then you have the display of achievements. So whatever achievements you have, you should be displaying it inside the hospital. So something like certain success rates that you have, the number of operations that you have done successfully, the zero infection rates that you are achieving, the patient satisfaction rate you are achieving. So whatever positive things that you see from the quality indicators, you should be displaying that. Okay, which contributes to the internal marketing. Then so positive indicators I have covered. So selected positive indicators you should be displaying. Then the star staff with why. I also covered this in the social media. So whatever things that you're doing for the employee, and like the monthly employee of the month or the annual employee of the year, so and why they have achieved that, so those things needs to be displayed, okay, which not only gives the patients about the kind of staff they are dealing with, but it also encourages the staff to do better. It's not like they are just given one day, they are given the certificate or and money, but not only that, but to make the staff remember that they have achieved this because of this work. So all the other staff, they are also equally motivated to do better, and hence contributing in the internal marketing efforts. And then you should also display about your strengths. So strengths like certain USP that you have, or certain equipment that you have, certain experienced manpower that you have. So all these things are your strengths and you should display it. Okay. Then we have our periodic check. So this is similar to the recurring activity checklist that we follow in quality implementation. It is followed by the quality team. So also in the marketing department, they should have a periodic check of all these things. Okay, so whether the patient feedback is taken, whether it is analyzed, whether it is whether the RCA kappa is done as per the patient feedback, those things needs to be checked on monthly basis. Then you have your PREM, then you have your PROM. So both experience measures and outcome measures needs to be checked, whether those are done, whether the RCA kappa which has to be followed after that, it's done or not, whether the trainings are conducted as per the training calendar or not, that needs to be seen. And the social media, how active it is, are the person is a person or the team responsible to post in the social media, are they doing enough, are they meeting the number of posts that they are supposed to do, okay, are they sticking to the plan or not, that needs to be checked. And the engagement, what kind of engagement they are getting in the social media, whether what kind of post is actually working, what kind of post it's having more reach, more engagement, that needs to be seen. And through that learning, they need to improve on their processes. And then we have your internal display of achievement, and you should not be doubting about whether I should do this or not, but whatever you just need to check on all the parameters, all the things that you feel like telling to the patient without a doubt. So those things need to be selected, agreed upon, and then it needs to be displayed. So now we have come to the end of this video, and thank you so much for watching this video till the end. And I request you to, if you have liked about this whole video, please like, comment, subscribe, so that I am motivated to make more such videos. I'll be making on other topics as well. So I'll cover everything. And hospital management is a subject, it keeps on evolving, and I will always have something to talk about. So thank you very much for watching. See you again.